As the title suggested, today we're going to be talking about rapamycin. Now, in medical school and residency and just, working in medicine, while it's a medication I'm familiar with, it's not one that we generally use in everyday practice. And I didn't really become aware of it as a potential tool in longevity and healthy aging until a couple years ago, and primarily through listening to podcasts by Dr. Peter Attia. And so while that gave me kind of a good overview, I really wanted to delve in a little bit further. And so I've been doing some research on it, and I thought I'd share some of my findings with you here today. So the origin of rapamycin is actually pretty interesting. The name Rapa comes from Rapa Nui or Easter Island, where several decades ago, they found it in soil samples and found that it had these antifungal properties. So fast forward to, more recent times, and what they've suggested based upon some of the research that's been done is that it could be powerful in terms of overall health as well as anti-aging. That being said, I think it's also important that we exercise some caution because we also know that it's a fairly powerful immunosuppressant. And so we really need to do some more research before deciding if it's actually safe outside of those indications. So today I'm hoping to pull back the cover, so to speak, and decide, is rapamycin, is it a game changer or is it just an immunosuppressant? While there's some data that suggests that it's helpful, and especially like, animal studies, do we have the same information as it relates to humans? Is this a whole lot of hype or is there really something more there? So again, let's go back to the history. Basically, it's the 1960s and researchers are exploring Easter Island and specifically Rapa Nui. And they stumbled upon this unique strain of soil bacteria. And what they found is that it was producing this antifungal substance. And this substance really caught everyone's attention, again, specifically because of its ability to inhibit fungal growth. But that was really just the tip of the iceberg. Scientists soon discovered that rapamycin does a whole lot more, and more than just taking out fungi. What they found is that it actually inhibits something called mTOR. And what mTOR stands for is the mechanistic target of rapamycin. And this is kind of like the master controller of cell growth, metabolism, and aging. And so this set off a flurry of research that continues to this day. So rapamycin was first approved by the FDA as an immunosuppressant for organ transplants and specifically kidney transplants. As an aside, my mom was a kidney transplant recipient and so had been on the medication at one time. The name for the drug when it's used in transplantation is Rapamycin. And it helps to prevent the immune system from rejecting the new kidney by kind of like dampening down the immune system. It's a really potent immunosuppressant drug. And so, again, it's great for organ transplant recipients, but it's not something you'd want to take lightly if you're healthy otherwise. So since the time of its original approval by the FDA for immunosuppression, we've also found some other pretty interesting uses for rapamycin. One of these is in what they call drug-eluting stents. So basically, after a patient has a heart attack, cardiologists will go in and inflate a balloon, what's called an angioplasty, and put a stent in there to help to keep that vessel open and patent. And what they found is that by adding the rapamycin into the stent, it actually helps to prevent clot formation, which is obviously advantageous in someone that's had a heart attack. Since then, they've also discovered what they call, rapalogs, kind of like an analog. One of these is something called everolimus, and this is a cancer medication. This is particularly helpful in certain types of breast and kidney cancer, as well as something that's called tuberous sclerosis complex, or TCC. And here's what gets even more interesting. So in 2015, the FDA approved an additional indication for the use of rapamycin in that form of Rapamycin. And that's for, this rare condition that's called lymphangioliomyomatosis, or LAM. And so this is this rare progressive lung disease. And just think about it. This is a lung disease that's so rare that really we don't have a whole lot of treatment options. But lo and behold, we have this already existing medication that they were able to use that can really help to stabilize overall lung function. And so this really underscores the rapamycin's ability to help to slow down abnormal cell growth, which is what makes it so interesting in anti-aging research. So let's dive into the reason that most of you are here, and that's the use of rapamycin for longevity purposes. What's really interesting is if you look at most of the research, basically what they show is that, regardless of the organism, and again, this is in a lab setting, it's been shown to improve lifespan. And that includes things like worms and fruit flies and yeast and in mice. And in fact, with mice, they've shown that even if you start it later in life, it can increase lifespan from anywhere from 9 to 25%, depending on the strain and the sex of the mice, which is pretty, jaw dropping when you think about, that kind of an overall impact on lifespan. And as an aside, can you imagine if we found a similar benefit, or even like half the benefit in humans as we see in mice? This would be a game changer. And yes, I know we're not mice, but if you look at the consistency in the ability of rapamycin to increase lifespan across species, I think that would be suggestive that it likely or has a high likelihood of showing similar benefits in humans. Now let's talk about mTOR, and this is where I'm going to use one of my analogies. Basically, think of it as like a cellular traffic controller. And so when mTOR is really active, the cells are basically, they're given a green light to grow and multiply and to build, which is fantastic, especially when you're younger and developing or you're recovering from an injury. But in older age, this constant growth signal can be really problematic, especially in terms of cancer and inflammation and overall cellular damage. And so rapamycin is basically like a strategic traffic light. And essentially it occasionally says, well, let's kind of slow down and clean up this mess first before we go on to build. And so the process is linked to something that's called autophagy, which is basically like where cells are recycling, old damaged components. So it's kind of like a housekeeping system for your cells. So by inhibiting mTOR, rapamycin encourages more house cleaning, which can lead to cells functioning better, especially in older age. So first, let's talk about immune function. So yes, as I mentioned earlier, rapamycin is known to be an immunosuppressant, but that's at higher doses. On the other hand, with lower kind of, more intermittent dosing, it's actually found to boost immune function. And this is especially true in older adults whose immunity is getting a little bit sluggish. And they've actually done a few randomized control trials that show that for individuals over 65 who received a short course of rapamycin, they actually had an improved response to the flu vaccine and actually had a lower rate of infections in the following year. And so this is one of the wildest parts of this whole story with rapamycin. It's not this all or nothing immune off switch. It's more of a rebalancing. And so, it really helps to dial down these overactive pathways. And by doing so, it may be helping to free up resources to better help to fight infections, which I think is pretty cool. Now, what about the cardiovascular system? So in terms of the heart, animal studies have consistently shown that rapamycin can help to prevent age-related cardiac dysfunction. And additionally, in aging mice, rapamycin has actually been shown to slow down the pathological thickening of the heart walls, which ultimately leads to better function of the heart as a pump, so it can pump more blood, and additionally reducing inflammation. Now, in one smaller study, and this was just a 10-week study that was performed on dogs, what they found is that the use of rapamycin could actually improve cardiac function versus the dogs that were on placebo. Now, they did perform a longer 6-month study, and while they didn't find in terms of an endpoint by doing an echocardiogram or ultrasound of the heart, improved function for dogs on rapamycin, they still reported, or at least the owners reported, that the dogs seemed more vital and had increased vitality and seemed more youthful. And so while it's definitely not a definitive conclusion, it's definitely pointing in the right direction. And so currently there are actually some labs pursuing whether rapamycin could be used to help extend the life of canines. And if it works in dogs, then that could potentially bode well in terms of the possibility to have a similar impact in humans. Now, what about cognitive functioning? So it's not uncommon as we age to have some degree of cognitive decline in loss of cognitive function. What's interesting is in mouse models for Alzheimer's disease, with the use of rapamycin, they have found that there are reduced plaques, decreased inflammation, and an overall improvement in cognitive performance. And so this is really fueling a lot of talk about future clinical trials, especially with early stage cognitive decline for humans. And while the human data isn't there yet, it's definitely interesting, especially given how pivotal we know, or the pivotal role that mTOR plays in cellular maintenance, that it's highly plausible the rapamycin may potentially play a role in reducing these toxic protein aggregates that can accumulate in our brains as we age. Now, in terms of cancer and tumor suppression, rapamycin, again, it has these anti-cancer benefits that have been well established. So it helps to slow down the cell growth and really reduces the tumor formation in rodents. And in fact, with some analogs of rapamycin, like everolimus, it's actually tied to, these are kind of mainstream oncology drugs at this point, again, for breast cancer and certain types of kidney cancers. And just as a fascinating side note, in organ transplant patients that are on a rapamycin-based immunosuppressant medication, they've actually found that they have lower rates of lymphoma and skin cancer when compared to similar patients who are not taking the medication. So again, ironically, while it's immunosuppressive, it may be simultaneously helping to protect against certain types of cancers better than, the alternative drugs. All that being said, it's definitely not a cure-all or a replacement for more proven cancer therapies. And if all this wasn't enough, there's some additional benefits. So one of the things they found is that the use of rapamycin can actually help to improve overall kidney function. And again, this isn't in kidney transplant patients. This is just kind of across the board kidney function. Additionally, it can help to prevent retinal degeneration. So, age-related vision problems. It can also help to improve gut health. And it's even been found to reverse basically periodontal disease in rodents. There is some additional studies or research as well that suggests that it can extend female fertility in mice, at least, by preserving overall ovarian function. And a few mouse strains of rapamycin even were able to avoid some age-related hearing loss. The bottom line is that, as you can gather from this discussion, is that rapamycin has such a wide range of really significant clinical impacts, particularly as it touches on organ systems and things that have to do with aging. Now, the million-dollar question is, does rapamycin have these same impacts in humans? And the short answer is no. The gold standard proof of extending a human lifespan, it would involve massive decades-long studies, and we don't have that data yet. We haven't done that research yet. But fortunately, we do have some shorter, smaller term trials that, rather than examining mortality, at least helped to look at some health markers. So the first of these studies was a trial actually by Manic, which showed overall improved immune function as well as lower rates of infections in older adults, basically through low-dose mTOR inhibition. And this was, again, a double-blind, placebo-controlled, high-quality study. Furthermore, these lamb trials were able to definitively prove that rapamycin can stabilize lung function. And again, this is a really promising for that rare disease. And lastly, we have the Pearl study. So this was a 1-year placebo-controlled trial testing low-dose rapamycin in adults with ages ranging from 50 to 85 years old. So the preliminary data, and this is all preprint, it has not been peer-reviewed yet, it suggests really good safety profile after 12 months. Additionally, what they found is that in females, at least, it seems to increase overall lean muscle mass, and in men, it increased bone density. Now, this is not definitive, but it's definitely promising. So here's the bottom line. The good news is that we have a lot of data that suggests that low to moderate doses of rapamycin on a short-term basis, used intermittently, is safe for older adults. And additionally, there's a lot of indications that it can have a positive impact on health markers, but we still don't have that, the data yet to say absolutely it's going to have a huge impact on overall lifespan. Now, as I'm sure you've gathered by this point, rapamycin isn't just some safe over-the-counter supplement. This is a powerful prescription medication that has some, real health impacts, especially at higher, longer-term doses. And so I think it'd be helpful to kind of go through those right now. As we've been discussing, the first is, immunosuppression and infection. So at a transplant level dose is a very strong immunosuppressant. And the result of this is it's going to make you more susceptible to infections. And this can include everything from bacterial to viral to fungal infections. And even at some lower doses, I would definitely want to exercise caution with the use of rapamycin. That being said, there's this paradox that low dose intermittent rapamycin can actually help to enhance certain immune functions, at least in older adults. But that doesn't mean it's going to be 100% risk free. Now, in terms of cancer risk, anytime you're suppressing someone's immune system, you always run the risk of increasing their likelihood of certain types of cancers, things like lymphoma and skin cancer. But as I mentioned earlier, one of the interesting things with rapamycin, at least when compared to other immunosuppressive medications, is that it actually could be, or it's been shown to be potentially beneficial and protective versus those types of cancer. Now, in terms of metabolic issues, unfortunately, rapamycin can cause some problems there, including increased cholesterol, triglycerides. It can increase your blood sugar, increases insulin resistance. And this is particularly true in these higher doses or people who are taking on a daily basis. But the good news is that by going to a lower dose and using it more intermittently, even something like weekly, it can help to mitigate for some of these effects. So in terms of organ and tissue effects, the first thing is that we do know that it can cause mouth ulcers. So think of things like canker sores. Additionally, it's been, in terms of side effects, some patients will report headaches and GI upset. And it also it's been found in certain patients to cause protein leakage in their urine. Furthermore, because mTOR plays such a critical role with, cell turnover, it can also lead to difficulty with prolonged wound healing. And then lastly, there are some animal studies that show that it can lead to infertility, particularly through testicular atrophy in male rodents. Now, we haven't seen the same research yet in humans, but again, only time will tell. But what's really crucial to remember here is, again, it comes down to the dosing. A lot of the side effects that we see are from patients who are on long-term, high daily dosing. With most of the longevity trials, it's really the focus more on these kind of lower intermittent doses. And so hopefully that mitigates for a lot of these health impacts. So if you're considering the use of rapamycin, this is why it's so important that you're working with a really good clinician who understands the drug, who can test you for things like lipid levels and glucose and kidney function, and even some immune function. This is a very powerful drug that can do quite a bit of harm if it's misused. So with all this interest in potential, benefits from rapamycin, unfortunately, there's a lot of myths that you may come across online or in social media. The first of these is this idea that, rapamycin is a miracle drug and it can add decades to your life. The reality is that we still don't have any conclusive evidence that it can improve human lifespan. We've got great studies showing that it improves health markers. And in animals, again, that, the mouse studies that I was discussing, they've shown that it could, improve lifespan anywhere from 9 to 25%. However, we haven't done similar studies in humans. So any claims about how it could help humans is still yet unproven. The next claim is that somehow rapamycin is going to, reverse aging, like a fountain of youth. Again, we have some data that suggests in certain areas, and this is things like immune function, for example, as we discussed previously, that it can help to reverse some of these age-related declines that we see in overall immune function. Unfortunately, that's simply just one area. And we don't have this kind of broad-based evidence or evidence that it's going to have a broad-based impact across, many additional markers of, these age-related declines that we all face. Another claim you may see, and I've come across this, is that at low doses, rapamycin is completely safe. You got nothing to worry about. But the reality is, even at these low doses, you can still see things like, mouth ulcers, or these GI issues, or elevated lipid levels, or headaches. And in fact, they did one study that found that 20 to 30% of the participants on a low dose rapamycin reported at least minor side effects. Now, this generally was manageable, but it's not gonna, the use of this drug is not gonna come without risks. Another claim is that rapamycin is just gonna completely wreck your immune system. The truth is that, sure, that's a distinct possibility, particularly at high continuous doses. However, that's primarily when we're using it for immunosuppression. Most of the studies that have been done looking for longevity purposes, it's more of a, low dosed, taken intermittently. And in fact, again, certain, older patients, at least that have been studied, have found, ironically, this improved immune system. our immune functioning. And so really it just comes down to the context. Context is crucial here. And so you should think about rapamycin really more as like a immune recalibration, at least at these, more moderate intermittent doses. But you still have to apply caution. Additionally, I've also seen some kind of spurious claims that rapamycin has actually been approved by the FDA for anti-aging, which is absolutely not the case. It's been approved for, as we said, these drug-eluting stents, certain types of cancers, immunosuppression in kidney transplant patients. But there have been no, FDA approvals as it relates to anti-aging. And so anyone using it for that would be using it in an off-label manner. And lastly, claims saying that, well, rapamycin, it looks beneficial. And so people should start it, the younger, the better. But the reality is most of the studies that we've seen for rapamycin suggest that it's really helpful in older adults. And even in older adults, we still don't have a ton of research there yet. But especially in younger adults, we know about these real risk factors. As I mentioned, it can cause potential, infertility issues. And mTOR also plays a major role in muscle growth. And again, there's going to be unknown long-term side effects. And there's a lot of big question marks around the use of rapamycin. So that being the case, most experts really lean towards rapamycin being most appropriate for older adults. So what's the final word? First, rapamycin is a legit medication. It is a potent immunosuppressant that's been approved for everything from cancers to kidney transplant patients to rare lung diseases. So this isn't just some random supplement. Additionally, it shows incredible promise, at least in animal studies, as it relates to improving lifespan and health span, primarily by dialing back that mTOR pathway and helping to enhance overall cellular cleanup. In terms of human data for aging, it's still early, but very encouraging, especially as it relates to short-term improvements in immunity, as well as some health markers for older adults. But it also has very real risks, including things like immunosuppression, metabolic changes, possible fertility issues, and more. But just keep in mind, this is primarily at those higher doses. It's off-label if you're going to use it for longevity. And so if you're considering it, you really want to make sure that you're working with a doctor that's knowledgeable about, longevity, and specifically knowledgeable about how much rapamycin you should be taking and whether it's appropriate for you. And it has to be someone who really understands, the side effects so they can help you to navigate those as well. And lastly, we really need to see some longer term human trials before we can definitively say that rapamycin helps by extending lifespan, as well as in terms of its ability to reduce age-related diseases. And bottom line, no drug in this, including rapamycin, is a substitute for things like diet and exercise and stress management and sleep. That being said, if you're an older adult that is, optimized in those areas and wanting to explore something for longevity, it's definitely something that you should keep on your radar. Just again, keep in mind that you want to make sure you're doing it in a safe and informed and in a responsible way. I'm Dr. Nick Carr. I'm here to help you make smarter choices to live a healthier life. I hope you appreciated this deep dive on rapamycin. I hope you found it as interesting as I did. If so, please go ahead and hit like and subscribe and share it with anyone else you think could find it beneficial. Thank you.